Good evening, all of you. Welcome to Healthcare Insights, and thanks for coming and tuning in at 4:30 on the last Saturday of this month. So after a long gap, we are restarting our Healthcare Insights program, and I welcome Suneetha Rao, our speaker. She is a dietitian, chief nutritionist from New Hospital, Bangalore, and Jay Srinivasan and Sandhya Rao, the founders of RedMed. Jay will host this session, and Sandhya will introduce the guest. And while the participants join in, I think, Sandhya, we can start with you introducing a little bit about Suneetha Rao, our main speaker for the day. So welcome all of you, and over to you, Sandhya.
Thank you so much, Meghu. It is my pleasure to introduce Ms. Suneetha Rao, our speaker for this evening. She is the Chief Nutritionist in New Hospitals and has a 14 plus years of experience in clinical dietetics. A topper and a gold medalist, Suneetha Rao is a registered dietitian with a master's in clinical dietetics and food service management. She is also a certified diabetes educator. Suneetha is a sought-after speaker at events promoting the cause of preventing kidney disease and non-communicable diseases. She has worked as diabetic counselor and lifestyle coach, conducted workshops and seminars for patients and caregivers in community and corporate settings. She has provided valuable content for the handbooks Nutritional Secrets, a patient education series for CKD, dialysis and post-renal transplant patients, which was recently launched in 8 Indian languages. She is a frequent contributor in nutrition articles and write-ups. In addition to all this, fun fact, she has also trained as a classical Kuchipudi dancer. Welcome to the webinar this evening, Suneetha. Thank you for being here today, in fact. I will share a detailed profile of hers on the chat later. This is a very brief one, and we will also share her coordinates for anybody who would like to reach out to her. The moderator for the session is Jay Srinivasan, the founder and CEO of RedMed Health Systems. He has over 30 years of multi-dimensional experience in healthcare in India, US, and Canada. Welcome, Jay. RedMed Health Systems is a connected health venture that enables affordable, preventive, personalized, and extended care safely and conveniently. RedMed's tagline, Extending Care by Design, says it all. And it is indeed a pleasure to be here today and introduce the moderator and the chief guest. Welcome, and it's over to you, Suneetha and Jay.
Thank you, Sandhya.
Thank you, Sandhya, and thank you for the warm introduction, and thank you once again.
A warm welcome to all the guests gathered here today. Hopefully, you will find today's event interesting and useful to all of you. Good afternoon, Suneetha. It's a pleasure to have you on today's show. We have heard about you, we have talked to you, and your passion comes through and through. There's no question about it. Your profile, your CV actually reads like someone who has dug deep into nutrition, as we will today. And hopefully you could pass on some of those nuggets of knowledge over to us that are practical, useful, and something that we can embrace and put in practice in our day-to-day lives. Health is such a big issue today, and it has always been, but more so today because of several congruent factors, as we all know. The pandemic is just one of them. The epidemic of chronic diseases, which has been attacking societies all over the world, and especially India, for the last 20 or 30 years, that is another dimension. We now have nuclear families, so both members of a family are at work, so that adds to a lot of stress levels and bringing up kids, holding on to the household, catering to everybody's needs, as well as our professional, desires and goals. So all of this put together actually puts a lot of strain in modern life. And it's not surprising that we are beginning to see an epidemic of sorts with chronic diseases, which Just to name a few of them: cardiovascular diseases, diabetes, chronic kidney diseases, chronic renal failure, cancer, and on and on and on. So these are the more important ones. And you must have read about all of them in the newspapers and in the media. What we will be hoping to accomplish today with Suneetha's help is to understand all these issues of health in terms of a preventive context and how diet fits in our day-to-day lives. That is good diet versus bad diet. And what is it that about good diets that we can embrace that keeps our health in good stead, so that we don't have to end up doing the expensive things like visiting hospitals and visiting specialists. That's the last resort that we should keep in mind. It's a very expensive thing. So it all starts with nutrition, and nutrition is something that we can talk about in the next hour and a half. Suneetha, over to you. I understand you want to start off with making a presentation of about 20 minutes, and then we could go into a Q&A between you and I, and then we can open it up to the audience for whatever questions they might have. So, Suneetha.
Yeah, first of all, let me thank you for those kind words. I hope I will be of a little help here today for all those who have joined us today. I also welcome all those who are with us today. And Mr. Jay very rightly said about the shift that we see in the kind of families these days, from the joint families to the nuclear families, which is putting a kind of a burden, an undue burden on just the parents. When they have to work as well as take care of the kids. It's all these, I think somewhere down the line, it reflects in the kind of lifestyle we get adapted to. So what I'm going to do today is I'll just share my presentation, which will give you a broad idea of what good diet is and what it is all about, lifestyle and health, and how we identify from the diet perspective, these non-communicable diseases. So beyond that, I think, as you said, we can take questions and then we can go a little deeper or specific, right? So let me share
a quick note, Suneetha, for the audience. Anyone wanting to ask a question might want to place it on the chat box addressed to either Sandhya or to Suneetha herself, and that will be picked up towards the end of the show in the Q&A session. Thank you.
Okay, well, right. Actually, this the role that the topic that you gave me today, role of nutrition in preventing chronic disease. It's a very vast topic, basically, and I've tried to do justice by covering a little of everything, so that then when we talk, we can go a little deeper. And so what I thought was I will first summarize just to get a gist of the whole thing. What do we mean by chronic diseases? Basically, these are the health conditions that last 1 year or more, and they may require an ongoing medical attention. That is, it's not like a one-time visit to the hospital, but a continuous follow-up in a medical center. And sometimes it can be debilitating. That is, it can affect the quality of life, or it can alter your daily living habits. So any of these things can actually encompass somebody who is having or who's suffering from chronic disease. And the common ones that we see are, of course, heart disease, hypertension, diabetes, and chronic kidney disease. Beyond this, there are many more, like just how you mentioned cancer and other things, even the respiratory illnesses that are becoming chronic these days. So there are many more, but let us first start with the most common ones that we know what to do to prevent. Now, when you look at the risk factors for most of these chronic illnesses, we have the non-modifiable risk factors, which we cannot do anything about, like the age, the gender, our genes. Basically, we can't tamper with them. But there are modifiable risk factors, like the habits, the it could be tobacco abuse or alcohol abuse, and the kind of diet the person is on, and the amount of physical activity somebody gets. Apart from that, the socio-economic, cultural, and environmental factors also play a very big role in determining some of the risk factors for these chronic ailments. For example, when we talk about globalization these days, isn't it? We say, oh, there's so much of globalization. So isn't it supposed to be actually something that is good for us? Isn't globalization a positive thing that's happening? Yeah, but then there are certain things that actually taking a toll on most of our health also. If you see, we have professionals working round the clock because they are catering to all the time zones. Then you see professionals who travel across very frequently. Earlier, the travels were not so frequent in most of the jobs. There were a few particular jobs that required traveling, but not all. But here, these days, you see many of them traveling all over and traveling across the time zones where their metabolism takes a hit. And then also the kind of food that they get in different time zones, in different countries, and different places also is so different that they find it so difficult to adapt. Apart from that, sometimes the environmental conditions like the hygiene, other things also affect the kind of risk that we may encounter. Now, I actually picked this slide up from the internet, but I liked it because it is giving you 2 steps in the chronic diseases. Basically, it's telling you the intermediate risk factors like the hypertension, diabetes. Otherwise, we would generally presume that once somebody is diagnosed of hypertension or diabetes, oh, this is already a chronic disease. But then here it's very nicely put in 2 steps, where we have these intermediate risk factors, as you see over here. So what it aims to tell us is, even if you're, it would always be better to prevent these risk factors, but if you are by chance already in this bracket, there is still a lot that you can do to control and manage these conditions so that you don't get into the more severe or where it affects the end organ damage happens. So most often when we see when patients or people don't control their hypertension, when they take it easy, when they say, okay, now I have taken the medication for 1 week and my BP is quite kind of normal, so I don't have to take it anymore. There are certain misconceptions like this in the society. Even diabetes, they say, okay, who says it's not curable? Now I'm fine, I'm going to stop it. So when things like that happen, or when they don't take care of it, manage it properly, then they can very quickly progress into these end stage or end organ damages, which are really difficult to deal with. And that affects the quality of life greatly. So when you talk about risk factors, I thought I would take one by one some of the important risk factors which we today can discuss about and see how it can be managed. And one of the most important risk factors is our body weight, which we can which is in our hands. It's a modifiable risk factor. And in fact, body weight again is something that actually predisposes us to so many other conditions like hypertension. Now, if you look at the pinwheel here, if you're overweight or obese, that leads to diabetes, hypertension, or heart disease. And then many of these conditions, that is the diabetes and heart disease diabetes and hypertension are the leading causes of kidney disease and heart disease. So now if you see one thing kind of triggers off so many other things. So there are steps where you can intervene and say, okay, I'm going to take control over here. I'm not going to proceed to the next stage. Right? This is what I wanted to make a point of. Now, moving on, when we say overweight or obesity, what is it? Is it that you just look at a person and say, oh my God, he doesn't look normal? No, it's not that. We have certain parameters where we categorize people into normal, overweight, and obese. So let us see what it is. Now, we calculate something called BMI. I'm sure many of you have already heard it, and you might already know what your BMI is. BMI is body mass index, and the normal is between 18 and 22. So if how do you calculate this? Now, how do you know whether you fall between this 18 and 22? This is a simple, very simple equation. You measure your height and the weight, and then in kgs and centimeters. So your weight in kgs divided by the square of your height in meters is what gives you a BMI. So if you fall between the 18 and 22, you are normal, and 22 to 25, it is overweight, and above that, it is obese. Now, also one another interesting fact that I think we all should know is if you just Google for your BMI, it will show you the Western standards or the regular world standards, where about 25 is overweight and about 30 is obese. But then because in India, that is another important thing that I think we all should make a note of. In India, we have a very high risk of cardiovascular disease and diabetes, as I think most of you already are aware of this fact. Something about our genes, something about our some hereditary factors predispose us to cardiac illnesses more than the Caucasian race. So in the interest of preventing cardiovascular risks or coronary heart diseases in the Indian population, what WHO, that is World Health Organization, suggested is that bring down the range of BMI to a lower range. So for Indians, our normal is 18 to 22. It's not 18 to 25, but it's 18 to 22. And about 22 to 25 is overweight, and about 25 is obese. So many of the times, people who come to me, they would have calculated their BMI on the internet. We have calculators on the internet available, and they tell me that, hey, look, I fall in the normal range. So sometimes I'll have to, we'll have to point this out. So is all obesity the same? We have two kinds of obesity. One is called the gynoid obesity, which is seen mostly in women, the female population, where most of the fat accumulates down on the hip region and the lower trunk region. And then there's the android obesity, that's the male pattern obesity, where it's typically an apple shape, where most of the fat is around the trunk, basically a paunch, a pot belly or a paunch, or the truncal obesity. It's called android obesity. So why do we make this difference now? The thing is, android obesity predisposes you to more of these risk factors or illnesses that we just discussed about. So it is the android obesity that we have to look for. And now these days, you see, even in women, the waist to hip, if you take the waist to hip circumference, the waist circumference is much higher than what it is supposed to be. So that is what is android obesity, and that can put you at a serious risk of developing diabetes, hypertension, and other illnesses. Now, what are the causes that we generally see for the overweight or obesity being so much prevalent these days? As you rightly put it, this 2 years of pandemic, in fact, 2.5 years of pandemic, it has very clearly shown us how physical activity can affect us to a great extent. Lack of physical activity actually can affect us to such a great extent. So, but even otherwise, we had started seeing this trend even in our Indian population, where the physical activity reduced so greatly, and the food choices started shifting from traditional foods to more of fast food, junk food, and other things. And the IT, basically the boom of IT, which saw people becoming a little more inactive, more and more inactive, in fact. So actually, when I started my practice about 14, 15 years ago, what we generally saw is that very few, in India, the malnutrition, when you look at the malnutrition scale, we saw people who were undernourished. But then somewhere down through my practice, I started realizing that the trend is shifting. We see more of obese children. I mean, very sadly, we see obesity and this overweight in child, pediatric population, which is really sad, not to mention about that adult population. So now I'll start moving towards the eating patterns, basically. So now we know what is underweight, we know what is overweight and obesity. So let's move on a little further into the food habits that we see in the community. Now, earlier again, we were kind of, what do you say? Our meals were more simple. They were more traditional, they were simple, and we had a minimalistic approach. Even if you go to a restaurant or a hotel, it would be an occasion to celebrate, rarely an anniversary or a birthday. And even, you know, I remember when we were kids, when we went to restaurants, the manager would come and ask, the whole family is here, so what is it? Is it some special occasion? But today it's not so. You see that people go to the restaurants left, right, and center. We don't need an occasion. So that is one shift that has really markedly happened all through the community, in all populations, and across all age groups. Even older people, you see, they enjoy eating out more often these days. So if you look at the two thalis that I have just displayed over here, the simple thali, which consisted of portions, just limited portions, which laid emphasis on the vegetables and the dal, the protein, that is. I'll talk more about the plate as I move through, but then I just wanted to give an example. But then when you look at a more elaborate thali, this is what is popular these days. So when you go to a restaurant, you want more. You're not happy with a limited choice. You want a larger choice. You want, even at home, if it is a holiday, then it is like, what do we cook? What extra do we make? So this is the trend. Even the breakfast, you see, we want buffet breakfast these days. We don't want a la carte. We want buffet. Why? Because we want to have choice. So when I ask people, why is it that they like buffet breakfast? What I hear is, dil mange more. So, you know, dil mange more, exactly. But isse agar dil mange more khana, to dil pe padega bhari, right? So the other thing is, of course, that these days the parents are more, what do you call, obliging parents. They want to satisfy their children's requests and needs. So they're very obliging. If you think about the generation before us, they were disciplining parents. They were more like, you know, disciplining parents. But here now we see most of the parents are more obliging parents. So that's another shift that we see. The child asks for a big popcorn, yes, they do get it. So that's how it is. So now there are a lot of studies also that supports obesity related to chronic disease. I don't want to go into those details. So now, what is the good word for us? The positive thing is that if I control my weight, so if I lose that extra weight that I have accumulated over the years, is it going to help me? Yes, it is, definitely. So even a modest weight loss can prevent or control many health problems, including blood pressure, diabetes, and kidney diseases, and needless to say, heart disease. So you get to your normal weight. Remember the BMI between 18 to 22. So the closer you get to this normal weight, the greater will be your health benefit. So now let us see what are the ways in which we can try to achieve this goal of getting closer to the normal. Yes, we have to lose weight, but there are many ways of losing weight. Now we want to do it the healthy way. So what's the healthy way of doing it? First thing is, of course, about the diet. I'll go deeper into the diet. The second thing is maintaining a food diary, what we call as behavioral modifications. That is, many a times people are not aware of what they are eating or what they're doing. They have this idea of eating healthy, but are they really doing it? They don't know. They don't have a control over it. So what we say is, we talk about behavioral modification, where we ask them to maintain food diary, and we give them some other tips, as a few more tips that we will be looking into as we move by. And then, of course, the third thing is exercise. Without physical activity, only diet is partly, it partly helps, but then all three are required. Your behavioral modification, a good diet, and physical activity. These three things are the ones that are going to lead you towards your healthy weight. Now, see, here you look at a food pyramid, which actually tells us the various food groups that we generally consume in a day. I'll be dealing a little more deeper into it. But then what is, many a times people want to lose, they are really very enthusiastic about losing weight, and they want to do it really quickly. It could be maybe because for some wedding at the end of the month, or something else, or whatever reason, they want quick results. But that doesn't happen. Actually, what happens is the faster you try to lose weight, the body undergoes a lot of trauma. The body has to go through a lot of trauma, and then you may achieve it at the end of the month, but then very soon you're going to put it back on. So if you lose 8 kgs, the next month, you because you won't be able to keep up that kind of a regime, you're going to put back those 8 kgs and probably an extra 2 more also. So that's the disadvantage. And also it takes a toll on your health, your general health. We see a lot of skin issues, loss of hair and other things. So we don't want to do it that way. We want to do a steady weight loss or steady diet pattern where you come to your closer to your goals slowly. So what is it? About 2 kgs a month is the safest way of losing weight. And if you can't do it yourself, you may have to consult a qualified dietitian to, guide you through this process. So looking into the ideal plate, what we call this ideal plate here, this is a plate which actually depicts what food groups you have to eat during your meals. Most of the time, what happens in a rush, we grab a couple of food groups, like, we may just eat chitrana and curd, lemon rice and curd, and then call it a meal. But there you are not getting all the food groups. So let me tell you what these food groups are. You have the vegetable group, and if you look at this plate, half of your plate has to be vegetables. So that's the way to go, basically. Most often we are so used to first serving rice into our plate and then going ahead and putting all the other sides on this, a little on the side. But that's not it. You have to first be big on vegetables, eat more vegetables, and then the lower half of the plate, if you again quarter it out, a quarter plate will be cereals and quarter plate will be proteins. So even in the cereal and the protein group, you have to choose very wisely, go for whole grains, not the processed grains, but the whole grains. We'll talk about I'll give you some of the examples of whole grains. It could be whole wheat, it could be, the unpolished rice, it could be many of the millets that are available, ragi, little millet and other things. So these millets, these whole grains are the ones that are going to give you the fiber, the more essential nutrients, and not just carbohydrates. So that's the way to go, basically. And then on the protein part of your plate, you have your dal, the whole grams, the whole lentils, and lean meat, basically the chicken and the poultry and the fish, which we term as lean meat, which are healthy meats. Along with this, of course, you have to include your dairy, the dairy in the form of a low-fat curd, or mostly curd. I would stick to curd over there. And then fruits also is another food group. So now we have 5 food groups over here. 1, 2, 3, 4. Yeah, so we have 4 food groups over here. So this is what we call as the ideal plate. Let me show you another interesting picture of a plate here. Here you have brown rice, you have a lot of vegetables, then you have the proteins, and here this plate is emphasizing on hydration, water. So that's the 5th food group. Mr. J, as I go by, if there's anything that you want to want me to elaborate or point out, you can please tell me that.
Sure. I think you're going fine. We'll go through your presentation, and then I might have some questions, and then
Sure,
we can have a discussion around it. Thank you.
Sure. So now, the other very important and interesting food group is the fats. Basically, now we have a lot of choice in fats, but then let me just divide it nutritionally for you here. Now we have something called saturated fats, trans fats, and oils. So if I have to just put it very simply in a simple language, trans fats are the ones that are actually made in the factory for the industry. That is, they take these oils like vegetable oils, like it could be, peanut oil or sesame oil or any kind of a vegetable oil, and they are processed to form solid. So earlier we used to call it dalda. So it has many names. It is generally referred to as partially hydrogenated vegetable oil or vegetable fat, dalda, vegetable shortenings in some places, and in vanaspati. So these are fats from the vegetable origin, and these are trans fats, which are really backstabbers. They are really bad for your heart, and I mean, nobody should consume these, neither children nor adults or elderly. So these are the ones that you have to look for whenever you buy processed food, factory made food or packaged ready-made food, because they tend to use these fats because the shelf life of the product is prolonged. They don't go rancid. These fats are more stable. So they prefer these fats. Even the palm oil, the next one that I was about to come to is the palm oil, which has more of saturated fats in it. It is very stable, and hence the industry uses this. The food industry uses these trans fats and palm oil as safe, cheap alternatives to prolong the shelf life of their product. However, these are really bad for us. They can actually clog your arteries. They can form the plaques, the atherosclerotic plaques inside the arteries, the blood vessels. So these are the ones that you have to look for whenever you buy some product. Go through the food label and see if these fats are there. Then if they're there, then you should not buy them. Now, what are the preferred oils that we have to use, preferred fats and oils that we can use at home? Most of these seed oils like the groundnut, sesame oil, mustard oil, safflower oil, soybean, sunflower, olive oil, or any, sometimes you also get blend of these oils like the safflower and the sunflower oil or things like that. These are also fine. Which are the ones that you have to use in moderation? The coconut oil, butter, and ghee. Now, the thing is, they do have some good aspects to it. Coconut oil has MUFA, that is the medium chain fatty acids. So it has certain, it has certain anti-inflammatory properties. Even ghee has anti-inflammatory properties. It has saturated fat, but it has some anti-inflammatory properties. Butter also belongs to the same category. But the thing is, they do contribute to cholesterol in the body. So that's the reason you have to be a little careful. Coconut oil doesn't contribute to cholesterol, but the animal fats like the butter and ghee do. On the whole, the amount of saturated fats present in these three oils are on the greater side. And so what we say is use them in moderation. But on the whole, now when you look at fats, whether the preferred choices or the moderate choices, on the whole, what you have to always remember is the fats and oils have to be used in small amounts in the whole cooking. It's not something that is used in large amounts. It forms the tip of the food pyramid. Now let me go back to this food pyramid. If you look at this, the whole pyramid, oil forms the tip of the pyramid. That means that you have to really use it in small quantities, whatever kind, even the preferred ones. So let me move on. So there are other tips that I would want to give to, eat healthy. Eat a variety of foods from each group. Now we just mentioned these food groups, the cereals, the proteins, the vegetables, the fruits, and the dairy. So you have to select from all these food groups. It should not be just sticking on to 2 major food groups and forgetting about the rest. Eat a variety of foods from each of the food groups. Choose the foods that are low in fat and sugar. They naturally low in fat and sugar. So what are those foods that are naturally low in fat and sugar? Those are the fruits and vegetables again. Then choose foods that are low in salt, that are not made with too much salt. That means pickles, papad, vadiums, then the ketchup, the mayonnaise, and all these processed foods are really high in salt. So these are the ones that you have to watch out for. And then stay hydrated. We often forget, we have the 5 food groups, fine, but hydration is also absolutely important. So stay hydrated all the time. So let's look at some of these foods that is definitely a no-no. When you go to a supermarket, the first thing that hits you are these colorful, good, tasty looking treats that cover shelves after shelves, which are all processed foods manufactured with loads of salt, loads of sugar. There's a lot of hidden sugar. Even if you're buying the chips, there will be sugar in it. If you're buying a sweet item, there will be salt in it. So that's how it is. So make sure you don't pick these up from the supermarket in great amounts. These have to be in very rare indulgence. Salt that I wanted to actually share with you all. WHO, that is World Health Organization, recommends about 5 grams of salt for an average person, basically Indian, who's not been diagnosed of any of the blood pressure or other chronic diseases, normal people. But then when a survey was done in 2016, when the survey was done, they saw that both in urban and rural settings in India, the consumption of salt was way higher. It was 11.2 grams. So this is the reality, basically. More than double of what is recommended, basically. Now, this is for normal people, but when somebody has been diagnosed of hypertension, the salt recommendation goes a little lower than this. Now, as I was talking about different cereals, that is the grains that are good for us, I did mention that you have to select cereals, the grains wisely, right? You have to look for grains that have more fiber, more nutrients in them. So, when you talk about this, you can't kind of miss out on the millets. Millets are the grains that have all these. They are a lot more in fiber. They are packed with other trace elements like selenium, zinc, copper, and other things, which are generally missing from the polished rice, or even if you look at brown rice and other varieties, the amount of trace elements present in these millets are much higher. So if you have a chance, if you get a chance to use millets once in a while, do include it in your meal plan, weekly meal plan, basically. But again, here a word of caution: we do get a lot of polished millets these days, so you have to look for unpolished, unprocessed millets. So how do you make healthy choices? Avoid processed food. Stock your refrigerator with plenty of fruits and vegetables. Read the label of the food that you're going to buy from a supermarket or from your grocery. What do you get when you read? What do you understand when you read a label? It mentions the serving size. Now, if you look at this, this is something that we actually want people to know, how to read the label. The ingredient that is present in the largest quantity is the one that is marked in the label first. That means if you see maida or white flour, and then sugar, and then fat, and so many other things, that means that product has white flour in the maximum proportion, and then the sugar, and then the fat. So look for these first few ingredients which are present in the larger quantities in that particular product. Definitely watch out for trans fats. So if product is sometimes they lure you with high fiber cookies or sugar-free cookies, but then the bottom line is to make it very tasty, they might have added wrong types of fats, because unless something is tasty, they cannot sell the product. So again, emphasizing on hydration. So when you want to hydrate yourself, what are the kinds of drinks that you can choose? These days we have a lot of choice. We're pampered for choice. Every time you go, again, you get those colorful bottles of juices, just so tempting. But then those also have high fructose corn syrup and so many additives which are really bad for us. High fructose corn syrup is another, kind of sugar that is implicated in stone formation. It's implicated in diabetes and other things. So what are the liquids that you have to go for? You can go for blended vegetable soups, teas, plain tea, green tea, herbal teas, nimbu pani, simple nimbu pani, buttermilk, tender coconut water, and of course, water. That's the first preference anyway, any day. And then you have these options. Now, actually, when we were in college, I had a friend who used to walk with me till the bus stop every day. And then we would, as college girls, we used to, have a little money in the pocket, and then we would see what we could buy. Then we were very thirsty, and it was, I think, hot afternoon. We both went towards this tender coconut water stall, and then he said it was 10 rupees or 15 rupees. I don't remember. It was, I think, 15 rupees. Then my friend said, oh, who will pay 15 rupees for tender coconut water? In 5 rupees, you can get a small bottle of the carbonated beverage, So that's how people tempt you. And that's how this marketing is done, these beverages tempt you. So why do we have to pay 15 rupees for a not so interesting tender coconut water when, you can get a carbonated, strong, punchy beverage for 5 rupees? So these are the things that have actually changed the market, changed the outlook, even in rural areas these days. Some of the, I had recently been to a workshop in the outskirts of Bangalore, and there, we saw a lot of children just buying these carbonated beverages because they thought that was something good, that was something hippie, and it's the cool thing to do. So because they see these ads on the TV, and then they get tempted. They leave what is there, what is grown in their backyard, and they go for these processed foods, and they are unfortunately available at very reasonable prices these days. So now, moving on, I wanted to include something about gut health, because without gut health, I think our talk about good nutrition will be incomplete. Now, gut health or probiotics, prebiotics has been the buzzword for many years now. And rightly so, in a way, I think it deserves its place, because when you might have heard, everybody might have heard that 80% of the diseases come from the start in the gut, they say. So this is in a way true. When you have a healthy gut, you have overall health. So let's talk a little about prebiotics and probiotics that are so very essential to maintain gut health. Now, in our intestines, we have something called good bacteria and bad bacteria. So we want to maintain the good bacteria in greater numbers and keep the bad bacteria under check, right? So for this, what we require is these prebiotics and probiotics. These prebiotics are essentially some starchy food. It's basically carbohydrates, but they are so slightly different kinds of starchy foods which feed the good bacteria. They actually are the fuel for the bacteria. So what are the prebiotics that we generally have in our house, or generally every kitchen is equipped with these things? Garlic, onion, banana, green leafy vegetables, barley, oats, flaxseed, wheat bran. All these have a good load of prebiotics. So these are a kind of starch that are very important for our gut health. Now, probiotics, these are the bacteria as such. These are specific strains of live bacteria found in the food that enter our gut, and they multiply there and they improve our gut health. So where do we get these? The curd, the buttermilk, traditionally made pickles. Now, I'm not saying that pickles is good for everybody. Yes, they are really salty, and people who are on medication or who should not be eating more salt should not be eating pickles also. But for general population, otherwise, traditionally made pickles are really good. Because they ferment over a period of time. Now, if you pick up a pickle bottle right out of the shelf in a supermarket, they may not be traditionally made because everything is a quick process. And so it will be like they use vinegar and other things and it won't be fermented. But then the way the grandma made it, that is the way where you get the probiotics. The fermented foods like idli, dosa, they also have these probiotics, but then when you heat them, the bacteria won't be live, but the byproducts of that and in general, the benefits it gives to the gut is still there. So fiber up. Now, the other thing, when we talk about gut health, we cannot exclude fiber, right? So we talked about pre and probiotics, but then all fiber or all carbohydrates are not the same. These fibers are kind of the insoluble fibers, or the ones that actually add bulk to our stools and that help in clearing up our intestines every morning. So these are they are cleansers basically. They act as detox. So what are those foods that have a lot of fiber? The vegetables, dry fruits and nuts, then whole grains, whole grams, lentils, like what we say kalu in Kannada, or chana, moong, rajma, these things, the lentils that have a peel on the top, these are the ones that are really having the soluble and the insoluble fiber. So make sure that you get enough of these every day in your diet so you can keep your system clean. And as I said, a healthy gut goes a long way in protecting you from various chronic diseases. In fact, recent studies have also shown that gut bacteria plays a very important role in the risk of chronic kidney disease as well. So what works best? We spoke about so many things. We spoke about the ideal body weight, then we came to food, we spoke about the plate, the different food groups, the hydration and fiber, and a lot of things. So let's just summarize it. A diet which is high in vegetables and fruits, which are rich in whole grains, that is the grains that have the fiber on top of them and not processed grains. Low fat dairy, not very high fat, but kind of medium and low fat dairy foods like yogurt, curds, or buttermilk and other things. Then the lean meat, that is where poultry and fish fall under this category. Then healthy fats in small quantities and adequate fluids. If you get these things right, you're sure you can move forward in a positive direction. Now, another important thing that I wanted to mention, especially when we have elderly in our household, or when we have elderly people in our community, this is something that is worth mentioning. These days, none of us get enough sunlight because we are so much indoors most of the time working. Sunlight has the vitamin D is called the sunshine vitamin, and you don't really get it through food. So though you have some mushrooms and some fortified foods and things like that, it's not sufficient. It's not really the best form. It's the sunshine that actually gives you the vitamin D. So make sure that you expose yourself, especially the elderly. They have to get their regular dose of sunshine to keep their vitamin D levels up. And these vitamin D, the vitamin D as such is implicated in so many of these metabolic cycles, which, when it is disturbed, leads to chronic diseases. So now you have a plan, you know that you have to eat your, plan your plate well, and you're ready to go. So you have to shop. So how can you make your plan work? Now I'm talking about the second aspect of what I just mentioned earlier, the behavioral modifications. Now, these are some things that actually help you or trick you into falling into the plan. So these are the techniques, which tips that we give to make sure that you follow the diet for a long time. So what you can do is keep a food diary of everything that you eat, because many a times we indulge in mindless eating. We eat things and we actually forget that we have eaten it. So anything that crosses your lips, food that goes into your mouth, has to be documented in a diary. Keep it for 10 days and you will be amazed to see what all has, escaped your attention. Then when you go for shopping, have a shopping list. Don't just randomly pick something from the shelf. You know what? You make a shopping list based on your healthy eating plan, and only pick those items that you want, and not everything that you find attractive over there. And don't shop when you're hungry, because when you're hungry, you cannot control yourself. Take a different, now this has helped many of my clients actually, this fourth point. When you know that there is a favorite eatery or a food outlet in that particular street, and whenever you go there, you are really tempted to buy something or eat something there, then very consciously avoid that street or avoid that road. That's the best thing, because once you step in, it's very difficult to stay away. Then store, in every household, I'm sure you have children, you have people of different age groups, where you may have to store certain foods that are not very healthy for all the people in the house, like maybe some biscuits for a diabetic who may need it at the end of, on an emergency, or a small munchie or a snack for a kid who just returns from the school. So these things are not meant for anybody. But then if you keep it openly on a dining table, everybody will reach out to it. Those who don't want to indulge in it, or those who don't need it, will also reach out to it, and they eat it. And even though they don't want to. So store your foods, these, especially these foods that are meant for children, which are slightly higher on salt and sugars. Store them in opaque containers so that you don't get tempted to reach out and have them. So those were the behavioral modifications, and believe me, those have really helped people. It may sound a little funny, but it has helped people. And the next important thing is now moving on from the diet into the physical activity. It helps a lot. We all know this. It helps us lose excess weight and keep it off. It helps in preventing high cholesterol. It builds strength and endurance. It helps to keep our muscle mass intact. Then it also helps you to cope with the stress and anxiety at the end of the day. And here I think I should mention something for the elderly. As I said, sunshine vitamin is so important, especially for the elderly. When you look at an elderly population, there are a few things that you have to keep in mind. That's the sunshine vitamin, the physical activity. They need physical activity regularly, because they are in that stage of life where the muscle is going down very quickly. So unless there is even a little bit of physical activity is okay, but something that they can do, it helps to protect that muscle mass and keep it from wasting. Then also you have to take care of the calcium needs, and calcium is best got from green leafy vegetables and also curds. So these green leafy vegetables are power-packed foods. They have calcium, they have vitamin A, they have they have iron, and also they have the fiber. So also, if you have noticed, constipation is one of the issues that troubles the elderly because of the loss of muscle tone. So green leafy vegetable does the trick, basically. So now, suppose somebody is already diagnosed of some of these things, that some of these metabolic disorders that we just mentioned, then it would be best to keep those under control the sugar. So first thing is get annual checkups, get tested frequently, and learn to control your blood sugars. Take your health into your hands, take it under your control, and make sure you have good blood sugar controls, blood pressure, whether it is medication, diet, lifestyle, all three. You have to put them into the effect and make sure it is under control, maintain a healthy body weight, get moving and watch what you're eating, and commit to quit. Commit to quit those, habits like smoking and, drinking. So those are the ones that will take you a long way. So since I work in a kidney unit, I generally make it a point to make this awareness. Basically, if somebody is diagnosed of kidney disease, then the kind of diet that they would need is slightly different. It may not be the healthiest diet, but it is a diet that actually caters to their kidney functions and keeps their creatinine or the kidney function as intact as possible for a long time. And it is a very special kind of a diet. And you will need a qualified renal nutritionist who can guide you with this diet. And so instead of just going Googling and trying to get around yourself, it's better to take professional help. Now, with that, actually, I would want to mention that these days you see a lot of nutritionists who are present on the social media. They call themselves nutritionists sometimes wellness experts. But then before you consult somebody, you have to make sure that they are really qualified. We nutritionists study for 5 years, 3 years of graduation, undergrad, and then 2 years of postgrad. And then we give a certification exam, which is conducted on an all India basis. So this is called the registered dietitians exam. So even if they're not registered dietitians, at least they should have, those 5 years of qualified education. So you have to look for this, otherwise you can get into trouble. So what do dietitians actually do? They look at your medications, they look at your condition, they look at the food habits that you already have, they look at the family setting, the work timings, everything, and the symptoms that you have, your age, your height, weight, your gender, everything is considered before planning a diet for you, which suits you and which can take you over a long period of time. So this is the advantage of consulting a qualified nutritionist. So I just wanted to make this point here. And thank you so much for the patient listening. And over to you, Mr. J, for the queries.
Thank you, Suneetha. That was a very well sequenced set of slides and progression through all the different kinds of food. I didn't want to interrupt you because, well, you had all the information right there. I'm going to start off with a sort of a provocative question for you. I'm sorry to spring this on you at the very beginning, but I think it would be of interest to much of the audience to hear from you. You are attached to a specialty hospital.
Okay, just a second. Can I stop share screen? Do you want me to?
Yes, Suneetha, you can stop.
Yeah, all right, thank you. Yeah, fine.
Okay. What I was saying was you are attached to a specialty hospital dealing with nephrology and kidney. So am I right in assuming that the people who come there and consult with you have already come there to speak to a specialist? They have some problem or the other dealing with nephrology or renal related issues, right? So it's probably a very skewed population that comes to see you. Which already have issues of a serious kind. And one of the things to attack the underlying problems is nutrition. And the specialist basically steers them towards you. And now you are making behavioral change recommendations to persons who have sort of gone down the wrong path. Am I right in saying that?
I agree with you. Yeah, you do have a point. But then going back to that, I would want to, actually we have urology and nephrology, and not all our patients are already into chronic kidney disease. So we have many, since we cater to pediatric urology as well, we have children coming in who are obese and who don't have any other condition. They may have small urinary issues and things like that. So we have obese children. We are seeing lot more obese children after the pandemic here. So we do see those kinds, and we see newly detected diabetes or those who are pre-diabetic. So we see them in the urology department. So those are also the patients who come to me, not only the skewed. But then addressing that question of yours, yes, when I see those people who already need some kind of a special diet therapy, uh, it is very difficult to deal with. First of all, as I just mentioned, the kidney diet is a little different. It's not exactly a very healthy diet. It is a diet where a lot of even healthy foods have to be consumed in moderation, or maybe sometimes eliminated because their certain electrolytes or other renal parameters are not in the range. So in such people, it takes a while. At least it takes actually about 40 minutes for me to make them understand exactly why they need this special diet, and then tell them how they can go about it. So here in our hospital, we make it a point to first list out a lot of foods that they can eat. Otherwise, as you said, I think they feel very depressed. So we have come up over the years. We have come up with so many foods that are okay for them to eat, and that don't increase their potassiums or don't increase their other renal parameters. So we keep adding to the list whenever we come across some new food or a new fruit. We research, go back and see where it stands in with respect to the electrolytes, and see where it can be included and things like that. So we have now built up quite a big list.
Where I was going with that question was basically this. People who are already in some kind of a disease state, who have come there for specialist consultation and have therefore come to you, in a sense, or paradoxically, the behavioral change required in terms of nutrition is easier, because either they go down the path of very severe diseases, that the progression of the disease, or they have even at this later stage, they have a way to get back. But on the other hand, people who are in reasonably good health, okay, who don't necessarily visit a specialty hospital such as yours, they are confronted with an altogether different problem, which you actually mentioned right off early in your slide presentation, which is behavioral change, because they are faced with all of these very, very tempting marketing from a variety of sources. So it's easier to grab a bottle of Coke. It is easier to go for a fast food thing. And nowadays, since we have nuclear families and there is so much time pressure and other stress, you tend to, and it's become much easier today in the last few years. You just go into your app and order something, right? I mean, this idea of home cooking, which we would like to think of nostalgically, it seems to be disappearing fast.
And kids are ordering it.
Right. So in the midst of that, behavioral change becomes all that more complex and all that more difficult, because you have to stay the course for a while for habits to take hold. Correct? How do you sort out those kind of issues as it relates to nutrition and diet?
So here you have to actually become a health coach, and not just do away with one-time counseling. Follow-up helps a lot. Just every time they come, or every time you connect with them, make sure that they are motivated enough. So motivation, see, as a diet counselor, I think what I have learned is to keep people motivated. You can't expect people to change, turn 360 degrees all of a sudden. Once in a while there will be life happens, and we all do indulge. Don't I go to a restaurant? Yes, of course I do. So things happen, but then you have to quickly realize that if it's there in your mind that okay, this is what I ate yesterday, and then so I have to be careful for the next few days. So that is something that we try to teach and follow up with them and keep them motivated. So this motivation is really important.
Okay. I just have a few more questions, because I would like to really open the floor to our audience questions and not hog the show. maybe 3 or 4 questions, and then Sandhya could open the thing to Q&A. My question now is that very interesting food plate that you show. Okay, 5 or 6 groups, including water or hydration, right?
Yes, 6 groups, including
yeah. In today's environment, especially when we have inflation, especially food inflation, right? For many families, the average Indian family, if you will, poor to middle class, is hard pressed to fit in all of those things at the same time. I mean, you're not going to be able to convince families of having a variety of vegetables on a plate, or a variety of grains on a plate, or a variety of fruits in a fruit bowl, right? So in such circumstances, do you advise them to go on a day-to-day basis, have one kind of vegetable today, another vegetable tomorrow, one kind of fruit today, which sort of spreads it out, you know?
Yeah, I think I didn't really give a clear picture of that. When we say a variety of fruits and vegetables, it's not in a day. It's through the week, basically. Now, you might have actually heard rainbow, choose from the rainbow, choose color of vegetables and things like that, fruits and vegetables. So today it can be orange, tomorrow it can be green. It's like that. And also when you said that vegetables are very expensive, yes, they are becoming dearer by the day. I agree, but there are also, now if you know that you have to, it's really important for your health, you will have to pay a little extra to buy those vegetables, and you can do a smart job. You don't have to really pick up the most costly vegetables. If you look at those squashes and the gourds, that they don't really exceed the prices very often. Sometimes if the carrot or the beans is very high, it doesn't mean that you have to buy it on that day and eat it. You can save it for another day when the prices come down. So this, I think most homemakers do it. I don't have to tell this, most homemakers do it. And just the awareness that, yes, I have to select the vegetable. I have to, I should not omit the vegetable. Most often, it's not because it's not because you can't buy the vegetable. Most often people at home don't have the time to cook it. Yeah. That's something that I have seen.
Okay. That's good. That's good. I have observed that myself in our household. We don't
it's try
to have everything together at one day we have pomegranate, and another day we go for something else.
Yes.
I want to focus your attention now on fats. You talked about saturated fats, unsaturated fats, hydrogenated oil, partially hydrogenated oil. Could we have a few one-liners on each of these so that people are able to appreciate more about these concepts? Because these are very important concepts as it relates to cholesterol buildup and plaque in the arteries and so on and so forth.
So steer clear of trans fats. So that means don't eat trans fats at all. Then include certain saturated fats like ghee, butter, and coconut oil in small, moderate portions. They are good for you to some extent, but it has to be in moderation. But other trans fats like palm oil have to be avoided. Then what are the oils you eat more? So use more of a vegetable or seed oils like the sesame oil, the mustard oil, the peanut oil, or the safflower oils. These oils have more of TUFA and they are good for you. Can I add, actually, I would like to add one more line. It would be really good if you can use 2 or 3 kinds of oils and fats in your regular cooking in your kitchen. You don't have to blend them and keep, but it has always been advised or researched and found that if you have, like maybe you can have a peanut oil and some ghee once in a while and a coconut oil, or a sesame oil, coconut oil, and a little bit of ghee, things like this. A combination of a little bit of saturated and unsaturated fats. But definitely no to trans fats and palm oils.
Okay. Palm oil has been in the news lately because Indonesia has banned the export, and we are big importers of palm oil. If palm oil is really bad, why are we fretting about the increase in palm oil prices? Because this is a good way for the government to actually say, stay clear of palm oil. There are so many other India-generated oils, and those are much better for your health. Why are we creating such a fuss about palm oil?
Unfortunately, the industry doesn't function like that. So these exports and imports are driven by the industry demands. And as I just mentioned, when I was talking about these fats, palm oil is a saturated fat. So when it is used in processed products, it could be any of the processed products like chips or sweetmeats or anything that is packaged and sold. It stays stable for a long time. That means your product won't smell of rancid oil for a long time under normal storage conditions. So industry wants to use this oil. It is available at a cheaper rate. It can be, it increases the shelf life of their product, and hence that is in greater demand in the industry. May not be, even if you look at hotel industry, most of the times when they make your dal tadka or whatever starter that you order, it could have a blend of palm oil and another oil in it, a little bit of butter and palm oil, because that's the way they cut cost.
Okay, so let me get this clear, because I would like the audience to appreciate this very useful point. Palm oil is bad, and the only reason we are seeing it so much in the news as if it's a big deal is because it's an industry-driven agenda. It is not in the interests of customers or consumers to stay in good health to even think of palm oil, correct?
You're right. You got it.
Okay. I hope the audience here has got that, because this is something that I wanted to really flesh it out with you, and I'm glad you did that. Okay, going back to oils, you mentioned a couple of words there in your slides. One was processed oil, or oil that has gone through a certain kind of chemical cleanup, if you will. And then we also see on labels, and increasingly on Indian oils as well. It used to be on olive oil only, but now we are seeing cold pressed oil. Can you draw the distinction between the two?
All right. So thank you for bringing out this point. Actually, I didn't want to complicate matters by putting everything together. But yes, see, we spoke about preferred oils. Preferred oils, not processed essentially, but preferred oils, I said, are the seeds and the nut oils, like the sesame, peanut, and coconut oil, and sesame peanut oils. So now you have refined oils and filtered oils, right? Generally, when you pick up the packet from your grocer, you see it's either refined oil or filtered oil, most of them. So these refined oils are the ones that
our apologies. We seem to have lost audio connection with Suneetha. Sandhya?
Yeah, let me try and call her.
Okay.
Meanwhile, we can request the audience to post their questions in the chat box.
Yes, please.
Yeah. While Suneetha gets back, she has a bandwidth issue, I think. You can post your questions.
I just wanted to assure Sabita there, I saw your note. We will certainly cycle back and have her repeat whatever she was saying. So don't worry about that. Welcome.
She will try to join on the phone. I think there was an internet outage.
Okay.
Am I available? Am
Yes.
I audible now?
Yes, you are.
Yes, Suneetha.
So Suneetha, well, let's go back to where you were with processed oil
Right.
versus refined oil.
Sorry for that small technical glitch. I
No,
think.
not a problem.
Yes. Yeah. So basically, we were talking about preferred oils, and those are the seed oils that I had just mentioned. And when you look at refined oils, these are we have two types of oils when you pick up in the market. One is the refined oil and the other is this filtered oil. Refined oils have gone through a lot of processing to remove the smell and the color of the oil. So they use petroleum products to refine oils. And the general understanding is that at the end of this processing, distillation that they do, the petroleum products are still, traces of it are still left in the refined oils. And that is the reason, that is one reason that refined oils are not actually healthy as they were deemed to be about 15 years ago. Everybody was gung-ho about refined oils. Then the second thing is, because it removes the smell and the color of the oil, they don't really care about the quality of the seed they use. So they can use second grade seeds, peanuts or sesame or whatever it is. They can use second grade seeds, sunflower seeds especially. So they begin with a not so good product. So compromised, making the oil with a compromised product. So ultimately, the end product also will be compromised in its nutritional quality. So that's the thing about refined oils. But filtered oils, they actually don't do so much of processing. It's somewhere in between, and they don't use a lot of petroleum products. It is just filtered to some extent to remove the bitterness of the seed. And so they still have if you buy filtered peanut oil, groundnut oil, they will have the smell of the peanut still. And if you look at the prices, the filtered oils are much costlier than the refined oils because it's not bulk produced like sunflower oils. And the quality of seed they select have to be premium quality seeds for filtered oils because they can't have that foul odor in the end product. So that's about it. Cold pressed is a step further, where actually the processing technique makes sure that it doesn't use a lot of heat sterilization or heat distillation. So the oil still has its natural goodness. So those are the three ways in which you can choose your oils. So cold filtered oils are good oils? Yes, they are. If you remember, we used to call it Ghana, oil Ghana. So earlier bullocks used to, turn the Ghana. Go around, yeah. Now you have machines to do that. So, okay, so it's basically the same thing. Okay. One last question from my side, and then Sandhya, you could open up to the audience questions. And this relates to two things noted, which seem to me kind of at odds with each other. One was you talked about cholesterol, that certain oils and certain fatty foods cause cholesterol buildup. At the same time, we spoke about vitamin D, sunlight. Now, vitamin D, with the aid of sunlight, requires cholesterol to be produced because vitamin D is not produced in the body naturally. So it's sunlight that uses cholesterol as a mediator or as a catalyst or whatever you will to convert it to vitamin D. And now, of course, we do have food supplements as in milk, which is vitamin D infused. But given that sunlight is still a requirement for bone quality and things like that, especially among seniors, and the emphasis you placed on vitamin D, doesn't it bring cholesterol back into the picture in terms of an adequate quantity that you need? So the thing about cholesterol is that you actually don't need to take all of it through your diet. Body is capable of producing endogenous cholesterol. And what we know about endogenous cholesterol production is it looks into how much of dietary cholesterol you ingest, and then it makes a little more than that in the body. So you keep your dietary cholesterol to a little lower, and your body will just produce enough cholesterol for all the metabolic processes that are required in the body. And another thing, including the vitamin D conversion, basically. So that was a very good point, actually. That's cholesterol is absolutely essential, but then body is capable of producing it endogenously to an extent that is required, and the dietary cholesterol that is required is a very small amount. So that is one thing. Then second thing is that we never say fat free. So that was another phase in this dietetics where we would say fat free, use all fat free. We never do that these days. We say moderate fat, medium fat, because we want our milk to still have that little bit of fat, because we want the vitamin D that is there to be absorbed. And vitamin D and vitamin A are fat soluble vitamins. So it requires a little bit of fat to be absorbed into the body. So that is the reason the little bit of ghee, the little bit of butter is essential. And also the dairy fat, whatever fat comes from milk is essential for us to absorb that vitamin, fat soluble vitamins that we need. That is an important point. But in moderation, that's enough in moderation. And government has started fortifying foods. Milk is fortified with vitamin D and vitamin A, E. Oil is fortified with vitamin E. In the long run, we will know whether it is for the good or for the bad anyway. So right now, we do get milk. We have good access to milk that is vitamin D fortified.
Under what circumstances can a person be cholesterol impaired? I mean, endogenous cholesterol that is produced by the body and might require dietary cholesterol.
You mean to say that a person may not be producing endogenous cholesterol and may require dietary cholesterol?
Right.
There may be few, disorders of lipid metabolism. I have not seen diseases of metabolic disorders where cholesterol synthesis is impaired, but yeah, there could be certain diseases where this happens, and then it may be supplemented with dietary cholesterol. So I would before making any comment on that, I think I will require to check on these.
Okay, no, not a problem. Thank you, Suneetha. At this point, let us have Sandhya open up to the audience and read the questions one by one so that we can get through all of them as much as possible.
Yeah, we do have a lot of questions which have come on PM also. So the first one is, what should one do if one has 2 or more chronic conditions and food recommended for one condition is not recommended for the other? For example, thyroidism and diabetes, or diabetes with BP and rheumatism. So how does one balance the food there?
Okay, so to make things a little more clearer, hypothyroidism or thyroid disease that's commonly seen in this population does not actually have any diet restrictions. Contrary to the belief that is there on the social media, you don't need to restrict cauliflower, cabbage, or foods containing soya and things like that. It is not required. It can be consumed in moderation. So here, a diet that caters to your management of diabetes will be good enough. The whole point will be actually to cut down refined sugars, to increase fiber, and maintain your body weight. That will cover both your problems, thyroid and diabetes.
Okay, thank you. What foods are recommended for bone strength?
Calcium, of course, and vitamin B. So as I was mentioning, you have to use the sunshine, and calcium foods, dairy comes first. So you can have the medium fat curds, and you can use paneer once in a while, and then you can move on to green leafy vegetables. Green leafy vegetables are excellent sources of calcium. You have to include them very often in a week. And then ragi and other millets are also very good sources of calcium.
Thank you. Ayurveda recommends that diabetic patients should not take dairy products. What do you think?
Well, there are a lot of controversies like this, but then I would want to know exactly. I have not come across this common generalization where even Ayurveda says you should not consume dairy if you are diabetic. There could be various. See, I'm not an Ayurvedic practitioner, but since we deal with these things very often, what I understand is Ayurveda divides people based on their body types like Vata, Pitta, and Kapha. So if somebody has a lot of kapha and has put on weight, and these are the people who are generally, they tend to have these metabolic disorders like diabetes, hypothyroidism, and all that. So that is how Ayurveda looks at this kapha and these metabolic disorders. So they say that milk, just milk and such things are not advisable for such people. And actually they do recommend thinned out buttermilk, which gives you enough of the probiotics and prebiotics that we want you to take. Even forget about Ayurveda. We don't actually recommend a lot of milk in adults.
Okay, thank you. Mr. Pati is saying quite informative. Thank you. My question is regarding COVID-19 preventives, drinks and herbs added to our regular intake. What are the recommendations and how does it affect when it is taken more?
Yeah, so that's a very pertinent question. So in the last 2 years, I think they've seen increased use of spices in every household. The kashaya or the khada that has been, that's become very popular these days. Uh, all these spices have something called ORAC values, that is antioxidative values. These actually reduce the inflammation in the body and they enhance immunity. However, if you use it in your regular daily cooking in sufficient amounts, they do the trick. And only, like, you don't pop in crocin just because crocin is good for you. It's similarly, even kashayas and these herbal concoctions, they are very potent. So you just can't keep taking them just because they are good. They also will have side effects. So we saw a lot of increase in gastritis. We saw, increase in peptic ulcer, aggravation of peptic ulcer disease in people who were already prone to it. A lot of people lost a lot of weight. So these are some of the side effects of using these herbal concoctions in excess.
That is a very interesting response. We wouldn't have really thought that we take these and we usually expect that the benefits are all good. We don't expect an adverse reaction. Thank you so much.
I think the underlying theme here is moderation, as with anything else in life, right?
Absolutely.
No, and also
Kashaya
to take it when it is needed and not
needed.
just to take it
Exactly.
earlier.
Right.
You should realize this. These have the potent medications in them, so you can't overdo them.
Right. Dr. Malabika is saying, is there any specific food that a person with chronic kidney problem and who is on dialysis should avoid?
Oh, there are a lot of, it would be very case specific. Maybe Dr. Malavika can connect with me for, discussion and a dialogue on this. But yes, you have to look at electrolytes. So a lot of foods that are rich in sodium, potassium, and phosphorus have to be avoided. Protein, if the patient is on dialysis, they will require a lot more protein than normal. So all these things are there.
I have received a lot more questions, but I shall read out the one here, Ms. Sabita's. If one is used to using refined oils more out of habit and what has been used in family for a long time, what is your advice to change over and to what oil?
They can first start off by introducing another oil, maybe typically filtered oil or a pressed oil. But one point to say is cold pressed oils are really expensive, so maybe filtered oil, whatever, and taper down the use of sunflower oil. Maybe the family is used to using oil that doesn't have the smell, so the moment they start using oils that have smell, people may not like it. There are certain sensitive people like that. So what they could do is start introducing oil and an extra filtered oil in their everyday cooking and slowly shift towards moderating between those two, using a small amount of refined oil once in a while, maybe when you're deep frying once in a while, should still be okay.
Thank you. One last question. There are many people who do away with rice, saying rice is bad, and so to reduce weight, they say we go on a rice-free diet. What is your
Rice
opinion
shaving.
on that?
I know. I know. So basically all grains that I just talked about have the same amount of carbohydrate, same amount of yield, the same amount of calories. So about 100 grams of white rice would, on an average, yield about 350 kilocalories. Even the millet would do the same. So it would depend upon your condition. And as Mr. J just mentioned, moderation is the key. Don't leave out a food group completely or a grain completely. Do use it in moderation. Maybe in extreme conditions, when somebody is having sugar levels which are really difficult to control, for a few days or till it comes under control, we may eliminate certain foods, but not necessary all the time.
Thank you. Miss Jayanti is saying in a very light-hearted manner, snacks in opaque container was just meant for me. I must tell you that it's probably meant for me also. Maybe the problem here is that we put it in that opaque container so we know where it is. Maybe we should ask somebody else to do it for us so we don't know where it is. Thank you. Thank you so much. Jay, did you have any other questions? Or since it's 6 o'clock, maybe you could propose a
I think we have just about covered everything. Suneetha really brought it out very nicely. I liked her presentation. It was comprehensive. It was some good summary, and she took us through all the stages. So my own set of questions, which I had a lot, when I began to review them, I found that most of the answers most of the questions had already been answered. And that left me with just a very few questions that I personally had, like the vitamin D one. So this was a very informative, very interesting session, Suneetha. We thank you for providing us a great deal of information and hopefully knowledge that we can take with us. Once again, this is to the audience. Suneetha is based out of Bangalore. She's attached to NU hospitals. And if any of you wishes to engage with her, you may please do so. She has graciously agreed to provide her coordinates here. So you're welcome to ask her and directly address yourself to her, especially questions of a very personal sort or complex questions that are very unique, which unfortunately cannot be taken up in a forum like this. So once again, thank you, Suneetha, on behalf of RedMed, on behalf of everybody gathered here, and Sandhya and myself and Meghu, we wish to thank you for making time to be here with us. Over to you, Meghu.
Yeah, thank you. Thank you so much. Well moderated session like Sabita's, comment here. And Sandhya, thanks for taking over the questions. And it was very, very enlightening, Suneetha. And of course, this time flies, most of these healthcare sessions, we have lots of questions, but we have to keep up the time. It's 6 o'clock already, so we have to close. I would like to say that next will be on June 25th, the next Healthcare Insights. So the topic will be announced. And the regulars, I want to thank the regulars here because they've been coming. This is the 12th session. So they've been coming every month. Usha Sridhar, Akhila Guhan, Sri Chandrababu, Sri Ravichandran, Sudha and Sarangapani, Meena Shah, Jayanti Manoharan, Telapa, Pati, always, regular with questions also. Thank you so much. Please attend and spread the knowledge, spread to others also, the link whenever it is shared. And check us out on our social media channels. This will be available on YouTube as well for those who have missed. Lots of regulars have missed today. So the YouTube link will be shared to them. And you can connect with Suneetha Rao for further questions. Thank you so much, Jay and Sandhya, for bringing the speaker. And thank you, Suneetha. It was a wonderful
Thank you.
session.
Actually, it was a pleasure to be with you all today. And thank you, Sandhya. And thank you, Mr. J, for having me here. Thank you. It was a pleasure.
Thank you.
Have a great evening, everybody.
Thank you.
Thanks.